Okay, so get ready because we're diving into the future of mental health care today. We're talking all about AI and not just the idea of AI, but how it can actually be used, like literally treatments tailored to you,
Hmm.
helping with diagnoses, even predicting issues before they become huge problems. It's pretty amazing stuff. But
Hmm.
there's always a but, right?
Right.
We're looking at a report that just came out, really new, from Xpio Health.
Yeah, they're great.
Yeah, they're like the leaders in behavioral health. And they just put this out there October 18th. And what they're saying is AI's got huge potential, but we got to make sure we're keeping patient data safe. And this isn't about your online shopping account getting hacked. This is about like the most personal stuff you can imagine, stuff that if it fell into the wrong
Oh,
hands,
absolutely.
yeah, could really be damaging.
It's a big deal because it's such personal information. We're talking about people's inner thoughts and feelings, their experiences, things that could be misunderstood or even used against them if we're not careful.
Exactly. And I feel like that's what XPO Health is saying. Like, hold up, we got to build this thing right from the start. One of the things they talked about that really struck me was this idea of data minimization. Ooh, sounds kind of basic, right? Only collect the info you actually need.
Yeah.
But when we're talking about AI, and AI needs information to learn, how do we decide what that bare minimum even is?
It's tough because you're always tempted to think, well, more data's got to be better, right?
Mm-hmm.
But with this kind of information, being too broad can really backfire. Think about it, more data, more chances for a breach or misuse. Data minimization, it's about asking those tough questions. Do we really need this specific piece of information? And if we do, are we doing everything we can to protect it?
So it's almost like instead of just piling everything into a safe and hoping for the best, it's like being really picky about what goes in there in the first place.
Exactly.
Yeah, okay, that makes sense. And speaking of keeping things safe, there was this whole section in the report about the need for explainable AI. I gotta admit, when I first saw that, I was like, what? It's a mouthful.
Yeah, what does that even mean? So tell me, what is explainable AI? And why should we even care about it when it comes to behavioral health?
Okay, so imagine you go to the doctor, right? And they say, the AI says you should try this new therapy. But then you ask, why? Hey. And they're like, we're not sure. The AI just said so.
Yeah, I'd be a little freaked out.
Exactly. And that's the problem. Many AI systems, they're like these black boxes. Data goes in, decisions come out, but you don't know what happens in between. Explainable AI is about opening up that black box.
Yeah.
It's making sure that the clinician and the patient get the why behind the AI's thinking.
So it's not just about getting an answer, it's about understanding the reasoning too.
Yes. And that transparency builds trust.
Right, I can see why this is important now.
It lets patients be a real part of their own care and helps clinicians use AI better.
Yeah, because otherwise it's like we're just blindly trusting this technology.
Right. It's not about replacing human judgment. It's about making it better. Okay, that makes a lot more sense. Now, while we're talking about AI making decisions, this whole thing got me thinking about AI bias. We've all heard about it, but what does that even look like when we're talking about AI being used in behavioral health? And what could happen if we don't watch out for it?
Yeah, it's a big deal for sure. Think about it. If an AI is learning from data, and that data mostly comes from a certain group of people, like let's say one age group or one background, and then you use that same AI to make decisions about people who are totally different. Well, it's like asking the AI to work without knowing all the facts.
So it's going to make mistakes.
Exactly, you could end up with wrong diagnoses, treatments that aren't right, even make existing inequalities in healthcare worse.
It's like trying to navigate a new city using a map from a totally different place.
Perfect analogy.
You might get there eventually, but you're going to get lost a few times on the way.
And in healthcare, getting lost can have really bad consequences. That's why this whole thing of using diverse data to train these AIs is so crucial. It's like, we got to make sure the AI gets a full picture of the human experience.
Not just a small part of it, yeah. Makes sense. So the report also touched on this idea of a privacy-first culture, and that's got to start with the healthcare organizations themselves. It sounds good, but what does that even look like in the real world?
It's about making privacy part of everything you do. It's not just a policy, it's a value. It starts at the top with leadership really committing to it, not just saying it, but actually making it happen. And then you got to give everyone the tools and the knowledge. I'm talking clinicians, staff, everyone, so they can handle sensitive information the right way.
So it's like training is important.
Training is huge, but it's more than just checking boxes, It's got to be about creating a space where people feel okay speaking up, Like if they have questions, concerns, or they see something that seems off. That's how you build a culture that really cares about privacy.
It's like everyone's responsible, not just one department or something. It sounds like a lot of work.
It is, but it's also a chance to do things differently.
And do them better.
Right.
For sure.
Yeah, I like that. It's about remembering that behind all this data, there are real people
Absolutely.
with real stories, and we got to protect those stories.
Couldn't have said it better myself.
Now, thinking about how we move forward with all of this,
Yeah.
one thing that really jumped out at me in this report, it's how much it focuses on what the patients are thinking and feeling. Like, it wasn't just about, the rules and the tech stuff. It was about making sure patients actually feel, I don't know, in control.
Yeah, that's so important. I mean, if we want people to trust AI with their mental health, we can't just throw it at them, right? It's got to be a partnership.
Totally. It makes you think, like, what would make you feel comfortable if it was your information being used? Right. That's the question we all need to be asking. For some folks, it might be about knowing exactly how their data is being used. Like, is it being shared? Who's seeing it? All of that.
Right. Transparency is huge.
For sure. And for others, maybe it's more about having choices, like what data they share, who they share it with.
Or even just being able to say, nope, not for me, to certain AI things.
Exactly. It's not one size fits all.
It's like we got to respect that everyone's different.
Absolutely. Building trust in this field means being flexible and really listening to what people need.
Yeah, because at the end of the day, this tech, it should be helping people, not making them scared to ask for help.
That's it. That's what it's all about. When we put people first, that's when AI can really shine.
I love that. Put people first. Man, this whole conversation has been really eye-opening. We've covered a lot, from how AI can actually personalize mental health care to making sure we're not compromising anyone's privacy in the process. It's complicated, no doubt, but super important. So to everyone listening, keep asking these questions, stay curious, and let's keep talking about this stuff, because the future of mental health care, it's on all of us. Thanks for joining us on the deep dive, everyone. And until next time, keep exploring,